I'm Dr. Jeremy Keeper. I'm a dentist and a scientist, and I've been helping to develop and use minimally invasive care techniques for at least 10 years. I first learned about this mode of dental care working at the University of Washington Dental Fears Research Center. This is a whole new era of dentistry. You could call it pharmacological dentistry, you could call it non-invasive therapy. And so what we've seen is a whole set of medicines that have a therapeutic effect as demonstrated in multiple randomized clinical trials, that stop cavities, that help to rebuild the lost tooth structure, that help to prevent decay in the future, and similarly for periodontal disease, for gum disease, that we have medicines at our doorstep that you could swish with and it would dramatically reduce gum disease, the effects of gum disease, bone loss from gum disease, and regain it in some ways. So we have peptides that soak into lost mineral and rebuild it. We have filling materials that are based on what teeth are made of. We have silver diamine fluoride, which, I mean, it's incredible if you think about it. It soaks into the teeth and replaces the lost material with silver that if bacteria come in, they die. If their acid comes in, it can get released and kills the bacteria and then replants itself in the teeth. We just published last year in the Journal of the American Dental Association a paper where we had tens of thousands of adult patients with little, what we call initial caries lesions. That same type of cavity that I got my license for drilling and filling. It's literally what I needed to drill and fill to get a dental license, was these initial cavities. We used these medicines on that same exact type of cavity, tens of thousands of patients, and we had 99% success year after year. 99%. Fillings don't have that success. But if you do a filling, you're removing the tooth structure, and unfortunately, anything human-made will fall apart eventually. And so that's the problem with our restorations, our fillings that we do, is that you remove tooth structure, and then on the margin between the filling and the tooth, that's where the recurrent decay can happen. So now you're worse off than when you started because decay has come back in after you've taken tooth structure away. Then you do a bigger, and then you do a bigger, and then you do bigger. When you use these medicines, you preserve your tooth structure, and therefore your long-term health. You limit your long-term cost, and so it works. Since the World Health Organization and the American Dental Association both say that these should be prioritized, it would seem like the ethical thing to do to always have clinicians offering these if they're relevant. And the range of these is dramatic. So we have some medicines that are totally proven out to treat very early decay, and we have some medicines that are totally proven out to treat very advanced decay. If I have a cavity, would it make sense for me to go get a needle and a drill and lose some tooth structure and replace it with some plastic? No, why wouldn't I use the medicine? So this is our next frontier, is bringing it throughout the center of society, where these medicines work so well when the disease is really severe. It works even better when the disease is mild. You know, and until we really get our nutrition under control and stop eating so much over-processed carbohydrates, so much sugar, we need medicines to counteract the effect of the long-term overconsumption of sugars. And these medicines work incredibly well.